Hi friends, welcome to the channel The Nurse. Here we are discussing about AIIMS NORCET 2023 Practice Nursing Questions Part 9. So we have discussed already 8 parts of videos. So you can go through that videos if you are not watched means. Then you can come to this 9th part of AIIMS NORCET questions, practice questions. So this video also contains 15 questions and answers, and it will be helpful for preparing upcoming AIIMS NORCET exams on 3rd of June. So I am going to the topic. Before that, if you are not subscribed to our channel, please subscribe, and we will move to the topic. And one more thing, if you are interested to join our AIIMS NORCET model test series, means you can download a Android application, the Nurse Academy, and you can join. So we will move to the topic. AIIMS NORCET 2023 Nursing MCQs Part 9. First question. Which of the following intervention is appropriate for preventing deep vein thrombosis in postoperative patients? Encouraging ambulation as soon as possible, administering prophylactic antibiotic, limiting fluid intake to prevent edema, placing the patient in a prone position. So here for preventing deep vein thrombosis, we need to encourage the mobilization, early mobilization. That will reduce the chance of occurrence of deep vein thrombosis. And administering prophylactic antibiotics will reduce the postoperative infections, limit fluid intake to prevent edema, that and also it will not reduce the occurrence of deep vein thrombosis. And placing the patient in a prone position, that will also that may leads to deep vein thrombosis unless it is not mobilized frequently. Deep vein thrombosis, a potential complication following surgery, and medical surgical nurses play a critical role in preventing its occurrence. So it is one of the complication during the postoperative period. So nurses have a great role in preventing deep vein thrombosis. So for that, encouraging ablation as soon as possible after surgery is an effective way to promote circulation and prevent blood clots from forming in the deep veins of the legs. So the easy method is encouraging ablation immediately after the postoperative period. Second question, which of the following is a common symptom of acute otitis media in children? Options: headache, vomiting, diarrhea, ear pain. So here correct answer is option D, ear pain. Ear pain is a common problems in children if they have acute otitis media. Otitis media means it is an infection of middle ear. So in children, ear pain will be the most common symptom. Acute otitis media is an infection of middle ear that often occurs in young children. Ear pain is a common symptoms along with fever and irritability. So fever, it is because of it is an infection, and ear pain is a commonest symptom. Third question, which of the following is not a common method of conducting literature review? This question is from nursing research. Options: narrative review, meta-analysis, case study, systematic review. So here correct answer is case study. Case study is not a common method of conducting a literature review. So case study is a not a common method of conducting literature review. Same time, a narrative review means it involves summarizing and synthesizing literature without a structured process. So if it is doing in a structured process, then it is called systematic review. Narrative review means it involves summarizing and synthesizing literature without a structured process. Same time, meta-analysis involves statistical analysis of the results of multiple studies. So there will be multiple studies on the same subject. Then in meta-analysis, it will study the statistical reviews. Then one more thing is a systematic review. Systematic review means a structured process. In narrative review, we learned that it is an unstructured process. Same time, systematic review means it is a structured process for identifying appraising and synthesizing literature. So case study, it is not a common method used in literature review. Fourth question, what is the purpose of literature review in nursing research? To establish a research question, to identify gaps in existing knowledge, to report the results of a study, to provide summary of the study method. Purpose of literature review, that is to identify gaps in existing knowledge. So somebody earlier they have done research, but still it is incomplete. So the nurse wanted to study in that gaps, and she wanted to review the literature, previous literature, and she will understand this some data are missing here. So she wanted to include in her research the newer data. The purpose of literature review in nursing research is to identify gaps in existing knowledge and to determine the state of current evidence. While literature review can inform the development of a research question, its primary purpose is not to establish a research question. That was our first option. The results of a study are, then third option, the results of a study are typically reported in research section in research article. So results will be posted in the its result portion or result area. At the same time, methods also it will be mentioned in in research study. There will be particular area to mention the methods used in that particular research study. Fifth question, which of the following is an example of a surgical nursing interventions? So I will give you the options. Administering medication to relieve pain, changing a patient's dressing, teaching a patient about their medication regimen, assisting a patient with ambulation. Here, surgical nursing intervention include changing a patient's dressing. So, surgical nursing intervention mainly postoperatively there will be a wound dressing. So, the changing dressing that will be an example for surgical nursing intervention. Surgical nursing involves caring for patients who have undergone a surgical procedure, which often includes management of postoperative wounds and incisions. Changing a patient's dressing is a common intervention performed by surgical nurses to ensure proper healing and prevent infections. I think it is an easy question. Sixth question, which of the following is a risk factor for sudden infant death syndrome? Options: prone sleeping position, breastfeeding, room sharing with the parents, use of a pacifier. Here correct answer is the risk factor for sudden infant syndrome or SIDS, that is prone sleeping position for infants. So that may leads to sudden infant death syndrome, but particular exact reason for that we couldn't, the researcher couldn't find out, but it is a risk factor. Infants who sleep on their stomach are at an increased risk for SIDS, that is sudden infant death syndrome. Breastfeeding, room sharing with parents, and use of a pacifier have been shown to reduce the risk of SIDS. Then seventh question, which of the following is a common database for nursing research literature? PubMed, Web of Science, Scopus, and option all of the above. So here correct answer is all of the above. PubMed, that is a free website or a free platform that we can use for review research literature, and the Web of Science and Scopus is a paid subscribed website. So you need to pay for that to get the details of the website. And so these are the common database for nursing research literature to review before the research process. PubMed, Web of Science, Scopus. PubMed, Web of Science and Scopus are all common databases used for nursing research literature. PubMed is a free database maintained by the National Library of Medicines, while Web of Science and Scopus are subscription-based databases. For subscription, they will take some amount of money. Eighth question, which of the following is a common medication used to treat asthma in children? Options: prednisone, albuterol, aspirin, acetaminophen. Here, correct answer is albuterol. Albuterol is an example of bronchodilator that is used to treat asthma in children. Albuterol is a bronchodilator that is commonly used to treat asthma in children. Prednisolone, it is a corticosteroid that may be used for severe asthma exacerbations. So commonly it will not use, but in the case of severe asthma exacerbation, we can use prednisolone to reduce the inflammatory process and bronchoconstriction. Aspirin should not be given to children because it may cause Reye's syndrome. Acetaminophen, that is paracetamol, is used for pain relief and fever reduction. Then ninth question, which of the following is a common complication of diabetes that medical surgical nurses should be aware of? Hypertension, deep vein thrombosis, diabetic retinopathy, osteoporosis. Correct answer here, diabetic retinopathy. The diabetic retinopathy is a common complication related to diabetes. Medical surgical nurses care for patients with a wide range of medical conditions including diabetes. Diabetic retinopathy is a common complication of diabetes that affects the eyes and can lead to blindness if left untreated. So if blood sugar is uncontrolled and untreated, it will lead to diabetic retinopathy and that may cause blindness. So controlling blood sugar or controlling the diabetes is the important unless it will progress into complications like diabetic retinopathy or diabetic nephropathy like symptoms or diabetic neuropathy. Medical surgical nurses should be familiar with the signs and symptoms of diabetic retinopathy and be able to provide appropriate education and referral to patients. So the nurses has to teach the patients about regular eye checkup and any symptoms of reduced visions and to control the blood sugar and diet planning. These are the responsibility of medical surgical nurses to teach the patients having diabetes. 10th questions. Which of the following is a potential limitation of a systematic review? So in previous question we have discussed what is a systematic review. So systematic review also have some potential limitations. So here which one is the potential limitation of the systematic review asked? First option, limited generalizability to specific population, biases introduced by the inclusion and exclusion criteria, inability to synthesize data across studies, all of the above. Here correct answer is all of the above. All three options are potential limitation of a systematic review. Limited generalizability to specific population, biases introduced by the inclusion and exclusion criteria, inability to synthesize data across studies. So these are the limitations. While systematic reviews are rigorous method of synthesizing literature, they may have limitations such as a limited generalizability to specific population, biases introduced by the inclusion and exclusion criteria, and difficulties in synthesizing data across studies. During the literature review or systematic reviews, there will be difficulty in generalizing the particular term to all the selected populations. So because of their selection criteria of sample. Sometimes that selection criteria also biased because of the reachability or because of the availability. The researcher may take the easiest way to pick the sample solutions. So that may leads to biased inclusion of the sample. Sometimes while removing the sample, sometimes the researcher may need to remove some sample from that total populations. So that time also the researchers' biases will be there. So these and all the reason, these and all the limitation of the systematic review. Then 11th question, which of the following medication is commonly used to manage pain in postoperative patients? Warfarin, furosemide, oxycodone, metformin. Correct answer is oxycodone. Warfarin is an anticoagulant, so that is used to prevent the blood clot in our blood vessels. Furosemide is a diuretic, so that is used to produce the urine more. Oxycodone, that is a opioid that is used to reduce the pain. Metformin is a OH, oral hypoglycemic agent, that is used to treat the diabetes. The nurses are often responsible for administering medication to manage pain in postoperative patients. Oxycodone, it is a commonly used opioid analgesic that is effective for moderate to severe pain relief. So usually the postoperative pain will be moderate to severe. So in that condition, we can use oxycodone as a analgesic. 12th question, which of the following is a potential complication of meningitis in children? Hypoglycemia, hypertension, dehydration, increased intracranial pressure. The potential complication of meningitis in children, that is increased intracranial pressure. Meningitis is an infection of the meninges. Meninges means that is covering the brain and spinal cord. Increased intracranial pressure can lead to serious complications such as seizures and brain damage. During the meningitis, the cerebrospinal fluid absorption and all will be impaired. So it will lead to increased intracranial pressure. So that will lead to seizures and brain damage. So there will be increased pressure inside the brain that leads to seizures, or sometimes permanent brain damage also may occur. Hypoglycemia, hypertension and dehydration are not typically associated with meningitis. Then 13th question, which of the following is a common respiratory complication that occur after surgery? Hypotension, anemia, pneumonia, constipation. So you can use a common sense here. In question itself, it is mentioned common respiratory complications. So we can easily avoid hypotension, anemia, constipation, because these are all not directly related to respiratory complication. Only thing is pneumonia. Pneumonia is a respiratory infection. So that will be the answer. So pneumonia, the nurses must monitor patients closely for complications following surgery, including respiratory complications. Pneumonia is a common respiratory complication that can occur due to decreased lung functions, impaired cough reflex, or prolonged immobilities. So due to the sedation effect and all, the patient lung function may be impaired, or sometimes patient respiratory cough reflex also may be impaired. So in that conditions, there may be occur or pooling of the respiratory secretions, or sometimes that the microorganism from the mouth itself, it will go into the lungs, and it will the bacterial growth will start, because in oral cavity there will be hundreds of microorganisms as a normal flora that may enter into lungs and will multiply, and it will cause infection like pneumonia. So mobilizing the patient, it is important in the case of pneumonia also, and sometimes the patient needed chest physiotherapy to mobilize the secretion to either cough it out, or the nurses has to give suction to remove the respiratory secretions. Then 14th question, which of the following is not a common type of research design in nursing research? Randomized controlled trial, case study, qualitative research, cross-sectional study. So here correct answer is case study is the correct answer. While Case studies can be useful method of exploring individual cases or situations. They are not considered a common research design in nursing research. Same time, randomized control trials or RCT, qualitative research and cross-sectional studies are all common research designs used in nursing research. You can refer our previous videos of research design, so you will get a clear idea. Then you can understand here what is a randomized control trial, what is qualitative research, and what is cross-sectional studies. So there will be similarities and differences in each research designs. So you can go through that. Then 15th question, what is the primary cause of death in infants under 1 year of age? Sudden infant death syndrome, respiratory distress syndrome, prematurity, congenital heart disease. Correct answer, sudden infant death syndrome or SIDS. Sudden infant death syndrome or SIDS is the leading cause of the death in infants under 1 year of age, and it is characterized by the sudden and unexplained death of an otherwise healthy infant, because there will not be an particular reason for that. Without a reason, suddenly the child may die. So that is known as sudden infant death syndrome. This data is based on US data. It is not based on data in India. So in the case of US, sudden infant death syndrome is the leading cause of death in infants under 1 year of age. So you need to find out what is the reason for leading reason for death in infants in India. So that will be homework for you. So that's about today's video. 15 questions we have discussed here. So thank you for watching this video. If you have any doubt means you can ask in comment sections, and you can also share with your friends. Then we can continue our video series for more candidates. So thank you for watching this video. Please stay tuned. We will come with another video soon. Bye bye.